there are different types of sleep problems that people face. Okay. Now, the first starting point is not to begin with a sleep study, but it's to understand what kind of a problem that people have. We have taken a history and we have understood what kind of a problem the patient has with respect to sleep. Then we may conclude that we want to look at the sleep in a little more detail. This includes the architecture of sleep. So in other words, we know how sleep is supposed to occur. What are the different stages of sleep? So this could involve our understanding of, is this person sleeping normally? Are they going into all the stages of sleep? Are the proportions of all these stages as they are supposed to be? Is there some disturbance? Is there a reduced amount of REM sleep? Is there an increased amount of REM sleep? Are the other phases of sleep or stages of sleep disturbed? And so on. So this is something we may want to look at. Second, so that would be, say for example, with very relevant to those who have insomnia. The second group of disorders which I told you about, the sleep disordered breathing. If we go one step more into parasomnias, I may want to understand the architecture of sleep. I may want to understand if there is any breathing problems, and I may want to understand, are there any unusual movements with the right leg, for example. So we may have some extra electrodes in the leg, or extra electrodes around the eyes, or some electrodes in the limbs, which will tell us all these things. So are there unusual movements? We may have a infrared camera looking at the subject, which will tell me whether the subject is talking during sleep, whether the subject has got up from the bed and moving around the bed, whether the subject has had, say for example, a seizure activity during sleep. There is a manual which is known as the American Association of Sleep Medicine's Manual of Sleep Scoring, in which the first part is dedicated to how to hook up a patient. And there are standardized points where each of these sensors have to be applied. Not only where they have to be applied, after application we have to do a calibration of all of these sensors, because these are sensors. We as sleep physicians know and understand that when you wear all these gadgetry and sleep, your sleep will be disturbed. We know it. Despite that, people will sleep. The efficiency of the sleep may be reduced, but they will sleep. Now the third thing that we understand is that when we interpret the sleep report, we take into consideration all these factors, we discount all those factors, and then we start looking at, despite all this, is this sleep report presenting any serious problems? And then we start looking at it in a diagnostic way. Children, even more so, are very specific about their sleep environment. If you and me as adults, we find it difficult to fall asleep in a hospital environment, you can just imagine what it is with kids. Kids are even more specific. It's not merely about the environment. They want some specific sensory inputs around them. They want to feel their hand on their mama. They want their own blanket, that soft texture of their own blanket. You change the blanket and give them their brother's blanket, they won't sleep that night. Okay, they want their particular toy with them, or they want a thumb in their mouth, or etc., etc. So first is sensitivity to the fact that children's sleep is far more prone to disturbance than adults. And their sleep staging is far more different and difficult to understand than adults. Where we think a hospital is the best and safest scenario for a child. For example, I told you about epilepsy disorders. They may be having fits, they may be having seizures. We may want a video recording of the semiology of the seizure. By semiology, we mean, how did it start? How did it progress? Which muscles did it involve? What kind of movements did it involve? Was it repetitive? Was it clonic? Was it tonic? So these may require a video backup. By and large, when we do these tests at home, it is rather difficult to get a video backup for these. There are blockages in your heart and you need to undergo a stenting. They will be ready to do it in a jiffy or with minimum consultation. or you tell somebody there is a possibility you have a cancer, you need to undergo a CT scan, they'll do it readily. The awareness that sleep can have problems which can spill over and affect health has still not hit a large amount of the population, and definitely also still not hit a large amount of the medical community. So as long as this awareness is lacking, the first thing, at least in our country, that patients will always approach this kind of information with is a sense of doubt.